Minister of Health Dr. Frank Anthony on Monday said the government was looking to make HIV prevention options more widely available to Guyanese by ensuring public services in this regard are more accessible with eligibility widened. He made the statement at the opening of a two-day training for more than 100 healthcare workers across the country on PrEP, pre-exposure prophylaxis, the medicine people at risk of HIV take to prevent getting the virus. The training is being facilitated by the National AIDS Program Secretariat NAPS in collaboration with the Pan American Health Organization PAHO and the Pan American Partnership Against HIV/AIDS PANCAP. With the aim of ramping up combination prevention, improving HIV care, and paving the way towards the elimination of HIV by 2030, Dr. Anthony said the government was looking to end the limited use of PrEP in Guyana.
Part of our prevention strategy, we want to make the maximum use of PrEP. And for us to do this, it means that all the clinics that we have must be able to roll out this particular roll out PrEP in all of our clinics. But to do so, we have to get people who are properly trained. So today we are addressing the training aspect, but if we are going to really roll this out in a very comprehensive way, it would also mean that we have to ensure that we have the backup facilities available. And that is, we must ensure that we have enough medicines available so that those medicines that we are giving as part of PrEP, they are readily available. We don't want people to be started on this and then we run out of medication.
It is for this reason that the training of healthcare professionals has become necessary at this time. Dr. Anthony has promised strict attention to ensure there is a backup facility which would ensure that there is no shortage in the medication that is always readily available. The rollout of this comprehensive plan this year marks the culmination of years of advocacy and partial PrEP implementation. The existing PrEP policy is a program for serodiscordant partners only, so couples in which just one partner is living with HIV have been able to access PrEP through the public healthcare system to avoid transmission to the HIV-negative partner. According to the NAPS manager, Dr. Tariq Jagnarine, the plan is now to evaluate anyone with risky sexual behavior. This would include men who have sex with men, female sex workers, drug addicts, and partners of HIV-positive persons.
So Guyana, currently based on our last preliminary calculations, this has not been published as yet. We're at 94, 70, 87, indicating a need that we have a lot of work to do, not only to maintain our prevention aspects of HIV, but also in ramping up our treatment as well as achieving viral suppression.
Since 2015, the World Health Organization has recommended that people at substantial risk of HIV infection should be offered PrEP. Several countries have prioritized key populations, including gay men and other men who have sex with men, sex workers, and transgender people, for PrEP programming. In Guyana, those groups also have higher HIV prevalence, 8% for transgender women, 6% for sex workers, and 5% for gay men and other men who have sex with men. Last year, Guyana's Society Against Sexual Orientation Discrimination, SASOD, moved from calling for a more inclusive PrEP program to offering the service itself. Guyana's HIV program results are among the Caribbean's best.